Cranial osteopathy, it's a very subtle form of osteopathic treatment that can be used to treat babies and kids with various conditions, various problems. It is beneficial for kids after experiencing traumatic birth. Also can be very helpful for babies that have digestive issues like constipation or reflux, or they hiccuping way too much, or they don't absorb the bottle as much as they need to. Also for overall just very jumpy, unsettled babies who seem to be very difficult to be put down, who would never lay down by themselves, who you always need to hold on, otherwise they keep waking up. Or for kids with some hyperactivity or delayed speech as well, and many more other things that cranial osteopathy can be very beneficial to. The research shows that there is very subtle movement between the bones in the head, and during the treatment we allow that movement to flow. So it may look sometimes that I'm just sitting there holding your baby's head for a certain amount of time and doing pretty much nothing, but because the movement is so subtle and it's already there, I just need to pretty much tune into it and allow it to flow, unwinding any restrictions that we might find on the way. The cranial osteopathy can also be used not necessarily just on the head. We can apply it for any part of the body. So we can apply it when we try to help babies with their digestive problems. Then I will have my hands on their tummy, or I can also do it through the low back, through the back in general. So it does not necessarily have to be just the problems or restrictions in the head that cranial osteopathy can help with. So we assess the whole body and help all the restrictions. Cranial osteopathy can also be used not only on babies, children, it can be applied to adults as well. Some people do favor that treatment because it's very gentle, very non-invasive treatment, and people with, for example, chronic fatigue syndrome, severe anxiety, depression, headaches, they may not benefit from very deep tissue work and they need something more subtle, something more gentle, which cranial osteopathy is. And I often do use it in combination with other modalities of osteopathic treatments like manipulations, adjustments, deep tissue work, but it's also a big part of our treatment routine and can be used to various conditions to allow patients be put at ease and feel more comfortable. I have used the cranial osteopathy in combination with other modalities for patients after road traffic accidents, major blows to the head, if they fall from big heights. They might have experienced just structural treatment before, like involving manipulations, clicking, and they did not seem to resolve 100%. They would feel better, but then again, they still would get the headaches, they still would feel not right. But after trying incorporating cranial osteopathy together with other modalities of osteopathic treatment, patients do report that it does help them formulate their thoughts a bit easier, speak easier, they feel overall much better, and their general well-being is also seem to be much better. They seem to have less problems with their sleep as well, and they report that their energy levels seem to get much higher.